Hello and welcome to another episode of Every Possible Angle. I am very excited to be joined here today by Dr. Gabriel Schnickel, Chief of the Division of Transplant and Hepatobiliary Surgery and the Surgical Director of Liver Transplantation at UC San Diego Health. Welcome to the program, Dr. Schnickel.
Great. Thanks for the invitation. I'm happy to be here. Look forward to the opportunity.
Absolutely. And looking forward to the conversation. And maybe just to start so that people can learn a little bit more about yourself, where did you start? How did you get into transplant? Where did your transplant journey start?
Sure. Yeah. Thanks. Good question. I get asked this question actually quite a bit by interested medical students and surgical residents. How did I start? Why did I pick transplant? Great question, and I would kind of harken back to my pre-medical school days where I really thought I was going to be a brain surgeon. I thought that sounded really cool and uh, impressive and dramatic. And then within the first week of taking neuropathophysiology in medical school, I promptly realized that's not for me. Maybe I'm not smart enough. I'm not sure. And then I wanted to be a heart surgeon all the way through the first couple of years of my residency training. And then I went into a basic science lab to pursue that career path. And that lab happened to be focused on heart and lung transplantation and really got intrigued by transplant immunology and the whole transplant process, and then kind of evolved over the next few years, kind of moving into the abdomen. And where I trained at UCLA, the liver transplant program was, really kind of the premier program at the university, and kind of really was fascinated by the transformation that went along with liver transplant, taking these patients from uh, dying in the ICU of their liver failure to getting them through the transplant and seeing them on the other side, after recovery. And it just was the whole transformative process was really exciting. And it's really a specialty that is filled with excitement and joy and transformation. I mean, if you think about it, the one of the few times where people are actually excited to come to the hospital is when they get called for, there's an organ available for them. They come in, and that excitement of their second chance at life is just it's just fun to be a part of. And so that joy and transformation kind of got hooked, and the rest is history, as they say.
I certainly have heard people talk about how transformative and the immediacy of impact, more so than a lot of therapies that the transplant has. It really is a hook. But I hadn't thought about that before. Sort of that very often when you're coming into the hospital, it's not for a great reason. But when you're coming in for transplant, this is something you've been anticipating and you're looking forward to. And that's carried through. And now when you move to liver, I had actually spent most of my medical device career in heart, and then got into liver only more recently. It's a fascinating organ. It does so much. Can you tell us a little bit about what you like about liver surgery and what you find interesting in the field?
Yeah, I think it's a great point. The liver is really amazing. It does so many different jobs in the body, and you know, no offense to the heart, but the heart's kind of just a muscle, and it just squeezes and contracts and pushes blood through the system. Whereas the liver is involved in so many different processes in the body that it's fascinating to be a part of. The fact that you can take part of it out and the other part gets bigger, and I find the anatomy is really fascinating to me. The fact that you can operate on the liver, take out part of the liver. You can do split liver transplants. You can do living donor liver. I mean, there's just so much variability to it, and every time you operate on a patient, their anatomy is just a little bit different. The and when you look at liver, you know chronic liver failure, like decompensated cirrhosis. Um, you know, those operations are can be really challenging, but again, so transformative to take out that shrunken, scarred liver and put a new liver in, and just see it almost immediately the change in the physiology of the patient. And you see it start working. It starts to clear lactic acid and make the clotting factors, and it's just really a fun to be a part of. It's an exciting operation, and technically challenging, which is offers its own reward in getting through the operation. But uh, yeah, just really I think a unique organ in the sense that it has so many different roles in the body and is so critical. I mean, we have dialysis that can help when the kidney fails. You have machines that can help augment or pump blood when the heart is failing. But really, there's nothing to replace the function of the liver at this point, because it does so many different things.
That's it's so true, and I would also say it also seems like, especially liver transplantation, um, is treating many different conditions. I mean, transplant in general is a very much a team sport. There's so many specialists and so many team members involved. But I think particularly in liver transplantation, whether it's oncology or bariatric surgery, there's so many different sort of specialties and disease states that you're causing. I mean, do you find you have to interact with a large portion of the hospital when you're in transplant and liver?
Yeah, that's really interesting point that you bring up. That we do liver transplant for a number of different indications. From you have acute liver failure, chronic liver disease, malignancies, and other kind of different indications that are unusual, like amyloid, um, and other things where the liver is not doing some of the processes it's supposed to do. So there's really a lot of, yeah, you're interacting with a lot of different specialties. The hepatologist, it's the nephrologist because of that liver kidney relationship. We do transplants for hepatopulmonary syndrome, where there's hypoxia due to the liver failure. So you're talking to the pulmonologist and the heart failure people. And then we do multi-organ transplants, where you're transplanting a heart and a liver,
Yeah.
liver and kidney, lung, liver. So yeah, you really get to interact with every specialty, and kind of everybody knows the liver team for sure. So, and it's fun and it's fascinating intellectually as well. Because there's so many different disease processes, you have to reach out and talk to a lot of different people. I'm learning every day, which um, is really fun. Even at my my age, I say these days. Yeah, it's fun because it's a new challenge, new things to learn, new therapies are coming out all the time that really change the way we practice, and it's constantly evolving, which is again an exciting field to be a part of.
And all of these fields are moving forward, and sort of the interaction between them, staying current and creative and intellectually on top of all of this is, I think really interesting. So you've been at UCSD since 2017, is that right?
That's right.
Can you tell me a little bit about what it was like when you first arrived, and the change in the program of the last few years?
Sure, yeah. So I arrived at the end of 2017, and I was recruited to come in as the director of liver transplant. Um, at that point in time, we were doing 35 liver transplants a year, about, and we had a lot of personnel changes in the first few months after I arrived, and we kind of uh, had to shake things up a little bit. And with my partners at the time, Kristen McKeel and Jen Berumen, um, we really kind of uh, put in some deliberate changes to the way the program ran, and we were able to slowly build up some momentum to the point where now we're, last year we did 144 liver transplants. So a lot of growth. Yeah, and a lot of we've added a lot of new partners, new surgeons. But it is such a team effort that we put together, I think, a really collaborative team that really works well together. And yeah, we've been able to do some really exciting things, and now we're in a whole new place with the liver program. And I attribute a lot to all my partners and to my hepatology partner, Reimagined, who helped really bring the program into new territory over the past few years.
That's fantastic. I mean, congratulations on the growth. It's incredible and fantastic to serve so many more patients every year. And I'm just curious. The change leadership can be challenging, but you have I've know a lot of your team members. It's what do you think about leadership to create such a excited and motivated team? You guys have this real collaborative sort of a culture that I've noticed.
Mhm.
And how do you feel when coming into a program, helping bring that about, and
Mhm.
your thoughts on sort of leadership within the medical field?
Yeah, yeah. I think that's an interesting question. Um, I think that the kind of the culture and the environment and the personalities are really critical to growth in a specialty like transplant that is so reliant on the collaboration and the teamwork that you really need to recruit and develop new team members that have that um, that kind of personality that it works well together, that is supportive, that looks out for one another. Because ultimately, our goal is to, do our best, do the right thing for our patients. And if everyone's aligned you know, in that goal with the secondary intention of helping one another, kind of selflessly at times, then the opportunity is there for to do really, I think, great things and to do big things because in this situation, I would say 1 plus 1 doesn't equal 2 in the sense that you know uh, two individuals are together are can do more than two individuals on their own. And so it's that synergy and that uh, uh, collaboration that really provides opportunity for growth and change. Um, and so trying to look for those people when you're growing the team and kind of asking the right questions, and then I think really we try hard to be open and curious. How can we do things different? You know, and keep an open mind about new ideas, not being stuck in dogma and not being stuck in the way it has been done. Look for new ways to do it, and as long as everyone's kind of aligned, again, you can do great things.
Yeah, it's such a good point. I mean, it can be something that's it's easy to sort of fall into your expertise and routine, and you do it. But the field is changing. There's new ways to do it, and people come at it from different problems, perspectives, from different backgrounds, and keeping that sort of humility and the openness that there might be ways we can tweak this and make this better. I think it's critical to any discipline, but certainly something as high stakes as this. I'm curious also, you're a teaching institution, and so much of surgical training is technical skills and the medical knowledge. Um, but this is something that I think is relatively consistent across transplant, is this that it needs to be a team sport, it needs to be very collaborative. You need to be able to influence different departments. Is that do you feel sort of a natural selection as students progress from their medical training into their specialty that it draws people who are more interested in that, or is that something that really has to be learned over the course of your career?
Yeah. So I think that for transplant, I think people who go into transplant surgery and transplant, writ large, whether it's the medical side or the surgical side, you know, you really feel a passion for it, and it is a tough specialty, and so having that passion is really imperative. But I think that what I tell trainees and students is it helps to find what energizes you. So a student that might be rotating on the surgery service, they may be interested in internal medicine, or they may be interested in emergency medicine, um, because that always ask what is it that you like about that specialty, rather than just they think that sounds like something they should go into. You have to find out what your everyone's a little bit different. What energizes you, what excites you, what makes you excited to come to work, or in the morning, and finding that and leveraging that. In terms of surgical skills, I mean, it helps to have some uh, dexterity and hand-eye coordination, but I would say technical skills from that aspect is really the least important part of surgery. I think it's decision making, and it's intellectual curiosity that are the most important facets of becoming a successful surgeon. Um, because you can train people to do those the actual operation, um, you know, but you can't. It's harder to train them to make the right choices and the right decisions, and so that part takes a little bit more. But I think that people don't focus on that as much as perhaps they should during training.
That's a very interesting insight. And so speaking of curiosity and pushing an envelope, UCSD has announced this new initiative, the Reimagine Center. Can you tell us a little bit about this effort?
Absolutely, yeah. It's something I'm very excited about. It is the UCSD Center for Research, Education, Innovation, and Transformation in Organ Donation. Our acronym is Reimagine Center. And we are an endeavor that is focused on the organ donation and allocation system, process, uh, to try to really transform transplantation, not just in the US, but around the world, by focusing our efforts on the donation and allocation process, hopefully making more organs available. And so we can hopefully eliminate the really the waiting list, as it were. So we want to make more organs available for everybody.
Anything we can do to get more patients transplanted, I fully agree. But what specifically prompts you to say this? We need to create this Reimagine Center, and what specifically are you trying to achieve? What are some of the ways, some of the projects you're doing to sort of achieve that goal?
Sure, absolutely. So what I found is that during my career, taking organ offers and working through the process of receiving an organ offer, trying to transform that into a transplant, um, uh, would run into a lot of frustration, and you kept noticing, like, why can't we do it this way? Why does it have to be that way? Why can't and I kept asking these questions about trying to change what was happening, because it seemed so, like, so many inefficiencies and just wrong thinking, and the wrong people were trying to answer questions with the wrong answer. But I just became more and more curious about why do things work the way they do? Why does the system set up this way when it could be done differently? And then you look outside the US and you see other systems are done differently, and what can we learn from them? And, and then, at the same time, we start to see, a fair amount of media coverage going on about, issues within the organ donation landscape. And then, Congress is getting involved. And so it seemed like all of these, I was getting, these, messages from the universe, kind of inspiring me to, with my collaborators, my colleagues, think how can we help? How can we, work on these issues? Because at the end of the day, our, you know, what we want to do is get our patients transplanted, and we've known for years that there is a shortage of donors, of organ donors, and that is the root problem of so many lives lost. But also, in transplant, we're always talking about, you know, careful stewardship of the organ, because we have this very limited resource in the United States, and we can't give an organ to everybody, right? And so some patients don't qualify to get on the waiting list for whatever organ it is, whether it's a kidney, a liver, or a heart, or lung. We don't allow them on the list because we think that, well, this isn't the best stewardship of this limited resource. And so we can't offer them a transplant. And so the waiting list doesn't even begin to cover the number of people that need transplants. Those are just the people that make it through the process. And so, you know, and we're covering all these disease, transplant is done, whatever solid organ you want to choose for a number of diseases, right? Whether it's, um, metabolic liver disease, or, primary sclerosing cholangitis, or whether you have IgA nephropathy, or you have, ischemic cardiomyopathy, or interstitial lung disease. Those are just a few of the indications, but at the the one resource that helps to take care of all of those patients, is the organ donor, is
Yeah.
the so
Transplantation.
yeah, transplantation. And to do transplants for each one of these systems, we need an organ donor. One donor can save 8 lives, right? They can transplant, so many people can benefit from just one organ donor, that if we can, that just makes it just a huge multiplying effect by, raising the number of organ donors out there. You can just have this multiplying effect across the country, and, across the world, really. If we can impact that, it's really because that's so foundational. We can have this profound effect, this rippling, in the water effect of impacting so many lives. So that's kind of the origin story of the Reimagined Center.
You know, the wait list is in many ways just the tip of the iceberg of the end stage organ failure disease state. And there are so many more patients if this was an unlimited resource. So in terms of some of the goals, I understand there's four pillars around the Reimagine Center. Can you tell us a little bit about sort of the areas of focus?
Sure. Yeah. So the Reimagined Center, while it's focused on organ donation and allocation, you know, we broke that down into four pillars because we thought these areas of focus would be a useful way to think about it and kind of break it down. So we have basic and translational sciences is one pillar. Another pillar is education and innovation. Our third pillar is equity, ethics, and policy. And then our fourth pillar is mindfulness, compassion, and wellness. And so those four pillars we feel like really cover the spectrum of issues that need to be addressed in organ donation and allocation.
And this is touches again sort of just how broad transplant can get, and if you're particularly if you're intellectually curious, um, you're now talking the areas of ethicists and policymakers, and there it gets so much more broad. Even we were talking about how broad it was within the hospital, within the medical specialty of all the different specialties you have to interact with, but now when we're talking about, especially on the donation side and allocation side, there's such breadth of different stakeholders to consider, or even different expertise, legal or ethical or philosophical scholars on because we're dealing with this question of death and this moment of death, and it's and also life, the equity of access. I mean, who gets this incredibly limited, scarce resource? How do we allocate that? I'm curious, what are some of the people you've brought into the project, and how's it going so far?
So far, so good. We've and you brought up a great point that part of our our vision is to bring in you know expertise and thought leaders from a broad diversity of specialties and outside of medicine even, so by getting people involved from um, whether they're ethicists, um, whether they're in the public health arena looking at policy. I'll give you one example of a project that we're working on. We've brought in an expert from our business school at UCSD, from the Rady School of Management, who is a logistics professor. We brought in an environmental health scientist who looks at the impact of um, you know uh, looking at the carbon emissions and whatnot, the impact, and we're looking at the how the effects of broad organ sharing is impacting um, you know costs and the of environmental sustainability. So we're getting people, and when you have conversations with people outside of the organ transplantation system, them learning about it really expands how you think about it. Like trying to explain how organ allocation works to someone who doesn't know is really fascinating, and then they'll ask very insightful questions like, well, why do you do it that way? That seems very strange. And they get really excited and interested in the process because it is so complex and has evolved over so many years with different iterations, that they're fascinated to bring in people from different backgrounds that have never touched organ donation or transplantation before. And so those are uh, projects that we're trying to get people outside of the typical transplantation network interested in what we're doing. So I would say it's very successful, to answer your question in a very long winded way. But uh, we've we've brought in and tried to get people excited about it from different areas of the University of California at San Diego, um, and I think we've been successful in that front. We've got basic scientists focused on organ rehabilitation, right, and new perfusion technologies. We've got people on the education side interested in how we can educate the public and educate the providers. We've got folks interested in that. Ethics is certainly a hot topic as we look at in situ machine perfusion across the country. Policy is a really huge right now, as the landscape in American government has changed dramatically over the past several months. And so policy is you have to put it all together and to put it into practice. You have to touches on that. And then the we have another project where we're trying to understand the um, you know contemplative science, looking at acts of altruism and measures of compassion in living donors, because there seem to be uh, we seem to be stuck in the number of living donors that we have in the United States. And how can we understand and how can we move the needle in living donation? I think that's an untouched or untapped resource in the United States versus other countries. So how can we change the landscape there? And so we're covering a lot of ground, and we're starting to, I think, pick up momentum. And people outside of transplant get really excited when you explain how their expertise might come into play and help make an impact.
It's true. It's a fascinating time right now because there is so much going on. I was talking to a group who are from an operations program. They do linear optimization, so they're looking at modeling of how how can we distribute better from a logistics standpoint. And I think some of the stuff you brought up speaks to how there are tensions in these choices, but also um, opportunities for creativity. For instance, you brought up equity and cost and logistics, environmental input. There's been changes to the allocation systems to do broader sharing, which have been shown to improve waitlist survival and equity of access, but also at the same time means transplant relies on a lot of private jets to go, and they're having to go further more frequently. That's thousands of pounds of jet fuel. That has a cost impact to the system, also to an environmental impact, and you know how we work and create solutions. It's looking at new solutions. I know, and we've worked with a variety of teams. Looking at we do alternative transport if we can also then have better preservation, and so I think, each one of these solutions sometimes creates new challenges, but that then creates opportunities for further, innovation and solutions if you bring the right creative minds to the table.
Absolutely, I could not agree more. I think that is um, as you, I mean, going back to first principles and in organ transplantation, as we talked about, teamwork, is really the bedrock of successful organ transplant, right? And so, if we can broaden the team, right? If we can bring in, more, you know, uh, intellectual power and from a broader diversity of backgrounds, it can only lead to better things, right? There's going to be more creative thought, more innovation. It's an exciting time right now in transplantation, but I think more broadly, I mean, we have just so much happening in both science and so much happening in you know AI really picking up steam. I mean, there's just so many possibilities now. If we can really diversify and broaden the people that are interested in organ donation, then I think that the sky's the limit. We can really solve this problem. And the vision of the Reimagined Center is no organs wasted, no patients waiting. And I really think that's possible. I really think that we can make that happen.
I love that. I think that's absolutely fantastic. It's if we broaden the team, bring more minds to the table, there's going to be more creative solutions. And you're right. It's in the last few years, things have been changing so rapidly. There's been so much change, but I think going back to one of the things you said about surgeons who get in the field, and I think this is across the board. Whether I talk to people on the OPO side and the surgical side, medical, even on the industry and the on the technical side in terms of technology development. Um, there's this passion, right? When you get into transplant, and I think there's enough passionate people if we bring them together and look at creative solutions. We really can continue to evolve and generate more ideas to solve these problems. And I think it's a very exciting time, and it's a fantastic initiative here with the Reimagine Center.
Ah, thanks for saying so. I appreciate that. It is exciting times, and I mean, you can probably hear it in the tone of my voice changes when I start talking about it. Yeah, it's exciting. It's really fun, and I think again, just to hammer that home, I think staying curious and staying open to the possibilities really is imperative to making change. I think that for too long the system has been stuck in, polarized and, into different camps of, we're right, no, you're right, no broader sharing, no less sharing. Um, and everyone kind of goes to their corner and digs in, and really what we need is we all want the best for our patients, but and we all have to think how can we how can we do better rather than retreating to our perspective camps and digging in and wanting to be right. I think that's such a problem. Maybe maybe it's a bigger problem now and or lately, but everyone wants to be right and they dig in on that, and their minds close and possibilities shrink. So we need to kind of flip the script and really push for open minds, open hearts, and I think that that opens possibilities.
I fully agree, and I'm curious your thoughts, because I feel that particularly in some of the debates I'll hear, it's um, uh, the discussion almost seems zero sum of, well, if you're going to do want to, you can either achieve this goal or achieve this goal, and um, from an engineering background, I just always see that as, well, that's an opportunity for a third option that solves both goals. And I'm curious how you see, I mean, one of the common ones is, OPOs want to place more organs, and transplant centers want to improve outcomes, and maintain really good outcomes. And um, I think with the right technologies and tools, and we're seeing a lot of evolution here, there's perhaps more ability to do both, is both increase acceptance rates and maintain really high quality and outcomes. And I'm curious your thoughts on how technology plays a role into some of these challenges or tensions or solutions.
Yeah, I think technology is critical, and I think we're again living in kind of a through going through a like a golden era of organ recovery and transplantation. It's very exciting. We have now a lot of different uh, engineering solutions to our historic problem of you know uh, take for example the liver. One problem that transplant surgeons worry about is you know you put if you put a liver that doesn't work into a patient there, you potentially get a primary non-function, or and that graft doesn't work and the patient doesn't survive, and that is a heavy
Heavy burden.
risk and burden to take. And so if you're risk averse, which you know we should all be to some extent, you're going to say no to a liver that is potentially um, going to work just fine for your patient because you're worried about the possibility of failure, which might be, the possibility might be only 20%. That seems really high in the moment. Now with machine perfusion, for example, you have the opportunity to assess and kind of you know determine whether that liver is going to function. You get it to see it in real time, like, okay, liver working on machine, okay for me to use, and that reduction in risk is going to allow for more transplants. And that's just one example. Another example would be changes in cold storage, where we can now we're always really worried about the ischemic time, right? The time from cross clamp to reperfusion in the liver, or the heart, or the lungs. We're always so worried historically about how long it's going to take, and if that liver's coming from far away, and the clock's ticking, and I got to start my operation. But if you have technology that can extend that time, then okay, I can take a deep breath. I can make this happen. I don't have to be so worried about the seconds ticking away as the organ travels from wherever it is. So those combinations of things are just completely changing the landscape of transplantation. And how can we leverage that, and at the same time keep the system efficient? And with these changes, we have to change the way, this is, we're still living in an allocation system that didn't have this technology. So do we have to
Mhm.
rethink the way organs are allocated now, to make it sustainable?
Right.
These are all, it's all happening at a seemingly a fairly rapid clip right now as technology builds up, and things are taking off, and so we have to be able to keep up with that, with the evolving landscape in organ donation.
Also, to keep up with things, and one of the pillars you said was education, and I believe you have coming up a pretty big educational event hosted by the Reimagine Center.
Yes, we do. At the end of May, the 29th and 30th, we are putting on a course, DCD in Action. It's an advanced course on normothermic regional perfusion. We're very excited about it. It's going to take place at the Center for the Future of Surgery here on the UC San Diego campus, which is, I think, probably the best surgical simulation center in the country, if not worldwide. We're also excited to be bringing in experts from around the world. We're collaborating with the Donation and Transplant Institute, DTI, from Spain, and we're bringing in experts in normothermic regional perfusion from Spain to help us educate, people in this workshop, this course, that people are going to get an opportunity to do, not just understand the logistics, the way DCD organs work, but we're also going to touch on policy. We're going to touch on the techniques, and people are going to get opportunity hands-on to do the cannulations, and to do an actual NRPs, on living tissue, which is exciting. And we're also bringing folks in from around the country, Angie Wall, Marty, Sellers from Pennsylvania. They're all going to be here, kind of, helping people learn, and, perhaps perfect their normothermic regional perfusion techniques. And this is kind of again, part of the mission of the Reimagine Center is education, so that we can provide an opportunity for people to, to hone their skills, learn new skills, and then they can take these out to their programs, to their OPOs, and through this course, we're going to hopefully be able to make more organs available, more viable organs available through NRP, which we firmly believe in here at UCSD and Reimagine Center. So this is really foundational to our mission, and we're super excited about it.
Well, I'm certainly excited about it. I remember talking to you about this months ago, and to see it come to fruition now is really exciting. And so you can find out more information about this event in the links. This is going to be a great event for hands-on training, particularly if you're looking to either expand your staff, or establish new staff able to perform NRP across the country. So Definitely contact UCSD for that. That's fantastic. Gabe, are there any other events or initiatives you really want to highlight for the Reimagine Center or UCSD in general?
Yeah, absolutely. Thanks for the opportunity. So, before the NRP course, we're having the first in a what we hope to be a robust series of grand rounds, a reimagined grand round speaker. We're having Macy Levin from NYU come out, and she's going to speak about organ donation and allocation system in the U.S. and its challenges. We're really excited about that. That's going to be on May 14th, I believe. Um, and that's going to be on campus at the medical school here, followed by a reception for Macy. And yeah, obviously, as anyone who knows Macy Levin, it would be really excited to hear her speak. She's really dynamic and really, I mean, knows the topic and has a lot of really amazing ideas about transformational change. So that's exciting. And then in October, we're going to have our second annual Reimagined Symposium in La Jolla at the Estancia Resort. It's going to be 3 days, and we're really excited about that. That's going to be a really, I think, exciting annual event. And we're going to be looking at big ideas in transformation of the organ donation allocation system. So we're looking for people hopefully who are excited about it, and we think it's going to be really incredible turnout. We're going to have some incredible speakers and great thought leaders from around the world speaking at the event. So looking forward to that.
Incredible work, and I just love this idea of just making the team bigger to bring more minds to the table. And thank you for all that you do every day in transplant, but also for this incredible initiative to help with organ donation and make transplantation more accessible to more patients. Truly enjoyed the conversation, and thank you for joining us today.
Thanks. It's always fun to chat with somebody who's as passionate about it as I am, and it's been a fun conversation. And I appreciate the opportunity.
And come back next time to every possible angle.